this video, we are going to look at the acute bacterial meningitis. The acute bacterial meningitis, and we are looking at the empirical treatment. So, firstly, we will look at the questions. The first question is, in age group of less than 1 month, what will be the pathogens commonly seen, and what will be the empirical treatment? So, what are the pathogens plus the treatment? Next we'll do is question 2. Question 2, we want to see in case of people from 2 years to 50 years, what is the pathogens and the treatment. The third question is in case of the post craniotomy, that is post craniotomy, or in case of head trauma, or from CSF rhinorrhea. So in such cases, what is the pathogens and the therapy. So in this video, we'll find the answers to all these questions and learn a lot more. So to begin with, we look at age group that is less than 1 month. So under 1 month of age, the pathogens, if you see, it includes the group B streptococci, and also the Enterobacteriaceae. Then it also includes the Listeria monocytogenes. So what is the treatment for this condition? The treatment is nothing but we administer the third generation cephalosporin, also the ampicillin, cephalosporin and the ampicillin. Next we move on to the 1 month to the 2 years. So when you go to 1 month and 2 years, there is again the group B streptococci, and there is also the presence of the E. coli. There is the H. influenza, next the S. pneumonia, and the N. meningitis. So what is the empirical therapy? The therapy includes, there is the third gen cephalosporin plus the ampicillin plus the vancomycin, and if the PRSP is suspected, this is in case if PRSP is suspected. Then we move on to the age group of 2 to 50 years. So in case of 2 to 50 years, so what is the condition? So in case of 2 to 50 years, and we are also looking for no risk factors. There is no risk factors for the listeria. So in such cases, the organism, if you see, it is the S. pneumonia as well as the N. meningitis. So what is the empirical therapy here? The empirical therapy here is nothing but there is the third gen cephalosporin as well as usual, and also the vancomycin. Next we move on to the age group. The age, that is, it should be greater than 50 years. So in terms of greater than 50 years, and there is no risk factors. And previously we saw there is no risk factors, whereas here risk factors are there, the risk factors of listeria. Now here the organisms, if you see, it is includes the S. pneumonia and N. meningitis as well as L monocytogenes. There is also inclusion of the group B. Group B, streptococci. So what does this include? So the treatment here includes the third generation cephalosporin, next the vancomycin, as well as the ampicillin. Then we move ahead. We look at the another condition. So here we are going to discuss about the post craniotomy. The post craniotomy, or in case of the head trauma and the CSF rhinorrhea. So in such cases, what is the organisms? So organism includes there's a gram negative bacilli. Then what is the treatment? The treatment here is nothing but there is the ceftazidime along with the vancomycin. The ceftazidime and the vancomycin. Next we look at the post-shunt surgery. The post-shunt surgery. So the post-shunt surgery, or it is known as the Maya reservoir. So in such case, what is the organisms? The organisms include the SRES, the coagulase negative staphylococci. Staphylococci. And what is the treatment here? The treatment will be by the ceftazidime, along with the vancomycin. Lastly, we are going to look at the immunocompromised state. So we are going to look at the immunocompromised state. So in such case, the organisms include the S pneumonia, then the N meningitis, also the L monocytogenes, Listeria monocytogenes, also the gram negative bacilli. So what is the treatment for this empirical treatment? It is nothing but there is a vancomycin, and then there is also the ampicillin, next also the cefepime. So vancomycin, ampicillin and the cefepime, or you can administer vancomycin along with the meropenem. Now we'll go on to answer our questions. So the first question we asked was in terms of the age being less than 1 month. So in such case, the bacteria groups include, there is a group B, streptococci. Next, there is also the Enterobacteriaceae and the Listeria monocytogenes. So what is the empirical treatment? Empirical treatment is nothing but there is a third gen cephalosporin along with the ampicillin. The next question we asked was in case of the ages, that is 2 to 50 years. And other thing to note is that there is no risk factors for the Listeria. So in such cases, what are the bacterial pathogens? The pathogens includes the S pneumoniae as well as the N meningitis. So we saw it is S pneumonia and N meningitis. And there is the empirical therapy, if you see, it includes, there is a third generation cephalosporin along with the vancomycin. Vancomycin. So now we'll move ahead with our next question. So the third question we asked was in case of the craniotomy. So post craniotomy. So post craniotomy as well as in case of the head trauma or the CSF rhinorrhea. So in such cases, the organism, the pathogen will be the gram-negative bacteria, the gram-negative bacilli, that is the bacilli. And what is the treatment? So here the treatment is the ceftazidime. Ceftazidime along with the vancomycin. Ceftazidime with the vancomycin. Now we'll move on to asking some bonus questions. So you can answer these questions in the comments. So the first question is in terms of 1 month to 2 years, what are the pathogens involved along with the empirical therapy? The second question we want to ask is in case of the age being greater than 50 years and with the risk factors for the listeria. So age is greater than 50 years along with risk factors for the listeria. What are the pathogens and what is the empirical therapy? This will be our second question. And third question we want to ask is in case of the post shunt surgery or the